Good afternoon all. Today we are going to do the dissection of thorax. This is the anterior thoracic wall. The ribs are counted from the manubrium, sternomanubrial junction. This is the second rib, third, fourth, fifth, sixth, seventh. The first 7 ribs are the true ribs. Now we will reflect the anterior thoracic wall and we will be able to see these structures. This is the body of the sternum. Here the sternopericardial ligaments are attached. 1 centimeter from the sternal margin, you are able to see this is the internal thoracic artery, internal thoracic vein. These are the internal thoracic vessels. They divide into the 6th intercostal space into musculophrenic artery and superior epigastric artery. And same wise, superior epigastric vein and musculophrenic vein, they unite and form the internal thoracic vein. Now here you are able to see the structures of the middle mediastinum. This is the pericardium with the heart. The pericardium shows 2 sinuses. Now we will see the transverse sinus. For this transverse sinus, you have to place one finger to the superior vena cava and the another finger in the left side. So the transverse sinus is in between the 2 ends. On one side there is the arterial end having the arch of aorta and pulmonary artery, and on the other side there is the venous end having superior vena cava, inferior vena cava and 4 pulmonary veins. So here is the position of the transverse sinus. Okay. Now the structures which are seen on the right side. Here you are able to see the structures visible through the right pleura. This is the root of the lung. On the roof of the root of the lung, this is the azygous vein. Then above there is the superior vena cava. Here you are able to see the superior vena cava. This is the right atrium and here is the inferior vena cava, which pierces the diaphragm.